one of the things that did draw me to public health and continue to draw me to it is that we're thinking about the whole person and not necessarily just one specific point in time or one point of care. And so when you're thinking about that, as you're looking at a problem, you're able to be able to see like what are the other things that can be impacting this specific problem. So that's one of the things that makes public health just it got the it factor for me. Like no matter what you're planning to do in your career, I feel like when you have a public health background, you're able to like maneuver into different areas like or different industries. Like public health, you can still take that to tech. Public health, you can still take that to healthcare. Public health, you can still take that to finance because it all goes back to that individual and their whole self. So I'm just glad I started there. Like in all honesty, I have no regrets starting there at all.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Hey friends, welcome to Public Health Careers. I spoke with Lydie Marc, who is a first-generation Haitian American with 16 years of experience in healthcare and the public health industry. In this episode, you'll hear a lot of great insights. You'll hear about how she stumbled into public health and her experience with her brother and sickle cell disease. You'll hear about how she's planning to improve access to health for everyone and how she overcomes barriers and obstacles as they come up. We discuss the differences between mentors and sponsors and why having both are important in your career development. We talk about the importance of being directionally correct as opposed to being absolutely correct in setting out our goals and our visions. She talks about why she chose to pursue a Master's of Public Health over a Master's of Health Administration, even though she aimed to make her impact in healthcare more specifically. And we talk about her path to becoming Senior Director of Fellows and Content for Nashville Health Care Council, where she has the pleasure of leading a program that creates a space for healthcare executives to discuss challenges and opportunities within the healthcare ecosystem. If you enjoyed today's conversation, all I ask is that you hit that subscribe button and leave a review. I greatly appreciate that. That really helps the show get out to more people. So be sure to hit that subscribe button and leave a review. Appreciate you all. Enjoy the show.
Hey, my name is Lydie Marc. I am a healthcare executive working to improve access to care by connecting leaders across the healthcare ecosystem, and you're listening to Public Health Careers.
Today, we have a passionate, innovative, and strategic executive with over 15 years of healthcare industry experience. Her one professional goal is improving access to health for everyone. She conferred a Bachelors in Health Science, Community Health at Georgia Southern University. She then went on to get a Master of Public Health in Health Services Policy and Management at the University of South Carolina. She currently works as Senior Director, Fellows and Content Strategy at Nashville Health Care Council, as well as is the host of the Access with Lydie podcast. We have Lydie Marc, MPH CHES. Welcome to the show.
Thank you. Thank you for having me.
It truly is my pleasure, and I'm looking forward to hearing more about your story. And it's always cool to have another podcaster. I know how it is to be on the other side. It's kind of weird sometimes. So
right.
I try to make it as stressless as I said for you as seamless as possible.
It's been good so far, so no complaints.
Awesome. I'm good to hear that. And just jumping right into the show, like how do you identify, and then tell us a little bit about your personal background?
Okay. I identify as she, her. A little bit about my background. I would say it all started when I was younger. I have a younger brother who passed away last year due to sickle cell disease, but he was born with sickle cell, grew up in Boston, where our family had to really be engaged with the healthcare ecosystem there in order for us to ensure that he had a good livelihood. And so as a result of that, I was exposed to the healthcare system very early on and saw how it can help and support a family in all different aspects. And I wanted to be a part of that, but I also knew that I did not want to be a nurse or a doctor. So sorry for those who are out there listening, mainly because I have a fear of needles that has still exists till this day, but I wanted to be able to provide some sort of impact in the healthcare ecosystem. And eventually that is when I found healthcare administration. And so, well, I know we're going to dive a little bit into that later on in our questions, but my background is really a passion growing out of my early childhood into adulthood with my younger brother. So yeah.
Well, I'm sorry to hear the loss of your brother,
Mhm.
but I always also think it's like admirable for you to like learn about this and then take it on and say, okay, how can I make an impact on health for others and in systems ways? And you've made your way to that through public health, through healthcare
Mhm.
administration, and the
Yep.
combination of that. So, sorry for the loss, but thank you
Mm,
for the work that you're doing.
thank you.
I should
Yeah.
say sorry for the loss and thank you for the work that you're doing.
Yes.
Your one professional goal is to improve
Mhm.
access to health for everyone. In
Mhm.
your pursuit of this, what challenges have you faced and how are you overcoming them?
Um, I would say the biggest challenge is that I realizing that access to care has many layers to it, as well as many avenues in order for individuals to be able to get to that outcome. The challenge in itself is that depending on the population you're serving, depending on the partnership that you have, there are different things that you're going to have to do differently than what is considered the norm in order to get there. I started off as a health educator back in Atlanta, Georgia. And even in that work that I was doing then, I was a HIV health educator working with target audience that either they already had HIV, or we were testing them to confirm what their status was. And one of the biggest things that I realized during that time is that when it comes to being able to improve access to care for people, you have to meet them where they are. You have to understand their circumstance and their environment. And the challenge with that is that not everyone is going to have that mindset going in. So not only are you having to think about that audience or the target audience that you have, but you're also having to think about the partner or the collaborator that you're going to be working with in order to get to that outcome. So it's balancing that and also just keeping sane as you're doing that, I would say, is one of the challenges when it comes to access to care, but also just why I do it is honestly, I know it's something that's doable for all. So, yeah.
And it's something that's needed. And
Yeah.
you said the public health golden rule, and I'm teaming it. The public health golden rule is like meet people where they're at, or meet
Yes.
communities where they're at. And I think that is a lot of what we try to do in public health. And I just think it's important that we
Hmm.
focus on doing that because, as you said, access is a big part of the puzzle, and we need to ensure that people have access, and people who need access the most have that kind of access.
Exactly. Exactly. Yeah.
So you're part of the Women in Healthcare Nashville Mentorship
Hmm.
Program. How has that mentorship played a role in your own professional growth, and how do you mentor others?
Yeah. Oh gosh. Mentorship and sponsorship, I know that's two things that identify with. Mentorship meaning that there's an individual that you are working with or consistently communicating with over a certain period of time. And then sponsorship for me is someone who may not be able to give you an X amount of time, but can help you get to that next area or next level that you're wanting to get to. I have had the pleasure of having both of those in my life. And in all honesty, I mean, it's one of those things that as a Black woman, you are not thinking that people are going to be supporting you. People are going to be wanting to see you succeed because you're not seeing a lot of individuals that look like you in the C suite or in higher roles. And so over the years, I've had the pleasure of having some phenomenal individuals sponsor me as well as mentor me to the role that I am now. And I'm forever grateful for them. I mean, one of them is Miss Jackie Brown at Empowerment Resource Center when I was in undergrad, where I literally was just kind of like, hey, I would like a volunteer opportunity to just learn more about how do you impact the community. And she was like, sure, like come work with me for the summer. And then over time, I've had different roles in that same organization. And it's just that a mentor is willing to take a chance on you, willing to pour into you, but also be able to teach you what they know. And I learned so much from her, as well as when it comes to the sponsorship. I've had individuals who are just like, hey, I know someone that works in that specific department you're looking into, or that specific organization you're looking to. Let me write an email on your behalf. Those type of two individuals are so critical for that have been so critical for me in my career, but also I have seen how I myself have been able to give that gift back as well to my mentees and individuals that I have sponsored. And I'm very intentional about that because I truly believe you never know how your personal journey can impact an individual. And especially in the realm of public health, we have evolved so much in the time that I've been here within public health, but we're also still stuck in a lot of different ways as well. And if there are opportunities to be able to connect public health as an entity to areas such as healthcare, which I feel like at times have been so siloed, there's an opportunity for us to either better serve our community, have better outcomes for individuals. So when I think about those two areas, I see and identify people who have mentored and sponsored me in my career, and I can do the same in order for us to really have an impact within the industry. Like that is, I'm always happy with that. Definitely always happy with that.
It's
Yeah.
just something that's so important, and I think a lot of us hop on like the mentorship side of things, but it's not until later on in my career that I understood the concept of like sponsoring or being sponsored by someone. And I
Yep.
think that is like what we're like literally trying to aim for, is like not being in a room and someone is speaking up for you on your behalf, or
Yes.
in your case, just reaching out, sending that introductory email
Yeah.
and putting you as part of that and starting that conversation for you, which I think is so important in so many ways. And I think it just speaks to, firstly, being someone that brings value to an organization, so that person is willing to put their brand
Yep.
and their name on the line to sponsor you, as well as just building a strong network of people that are in your ball court, that kind of know what the things that you're trying to accomplish in your career and can help you along that way. Because many times we don't know what we don't know. And as we know, public health, healthcare, there's so much to learn in there. So like really building those relationships, I think, are so important.
Yeah. Can I add to that as well?
Absolutely.
Just something you just said just made me think about that. So I feel like also another reason why I've been fortunate for individuals to mentor me and sponsor me is because I'm clear on my ask and I'm clear on what it is that I'm looking to do. A lot of times I have found if an individual is unclear on what they want to do or what the outcome is that they're looking for, it's going to be very challenging or even difficult for someone who has an interest to help you to actually help you out. So as an individual, you have to ensure that to the best of your ability that you understand what it is that you're asking either to be mentored on or to be sponsored for, because like you said, that individual's putting their name, their brand on the line. And so if that is the case, they want to be able to do this favor for you or this work for you in good faith. And they can't do that if you're unclear on what it is that you want to do. So I'm always just like, if you're looking for a mentor, if you're, seeking someone to be a sponsor for you, be clear. And if you're not clear, let them know like, hey, I'm not sure exactly how I would like your help, but I just feel drawn to the work that you're doing or how you're navigating this specific thing. And I just want to be able to speak with you on this. People are willing to give their time. It's when they feel like they're wasting their time. That's when I feel like there is that pause to help out. So just wanted to add that. Yeah.
And that's key in understanding, like just coming to
Mm-hmm.
the table knowing what you want and like doing your research ahead of time to know like
Yes.
what is it that I want, what is it that this person specifically can help and support me with in my
Yeah.
career. And like to your point again, if you don't know that, let them know that ahead of like
Mm-hmm.
upfront, and then
Mm-hmm.
work through that with them, or maybe that is the mentorship that you need to kind of
Yeah.
help them to guide you along your path. So good insights there. So
Yeah.
before we get more into your collegiate journey,
Okay.
what does public health mean to you?
Oh my gosh. Public health for me is the key to a lot of the issues we're dealing with healthcare today. Um, my background in public health has allowed me to really understand and really think about what are the opportunities that we have in order to really be as leaders and decision makers to really have an impact in the industry. And public health for me is that foundation, because one of the things that did draw me to public health and continue to draw me to it is that we're thinking about the whole person and not necessarily just one specific point in time or one point of care. And so when you're thinking about that, as you're looking at a problem, you're able to see like, what are the other things that can be impacting this specific problem? So that's one of the things that makes public health just it. It got the it factor for me. Like, no matter what you're planning to do in your career, I feel like when you have a public health background, you're able to like maneuver into different areas, like, or different industries. Like public health, you can still take that to tech. Public health, you can still take that to healthcare. Public health, you can still take that to finance, because it all goes back to that individual and their whole self. So I'm just glad I started there. Like, in all honesty, I have no regrets starting there at all. Yeah.
Yeah, I'm glad you lifted that up, because I feel very similarly. I think of public health many times as a skill set or like framework of viewing the world and working and operating in the world, more
Yeah.
so than a field. And as we have seen, I think over the pandemic, a lot of industries outside of traditional quote unquote public health has seen the value in that skill set
Yes.
or in that framework, and I think that's going to continue to be the case. So yeah, just knowing that it is something that's very valuable in being able to connect the dots and thinking about things from a holistic perspective. So I appreciate you sharing.
Yeah.
Okay, so you started your undergrad career as a bachelor's in health science. Or I should say you got a bachelor's in health science,
Yes.
community health at Georgia Southern University. I feel like really
Yes.
people
Go
start
Eagles.
and go
Go Eagles. Whoever's in there, go Eagles.
Go Eagles. So what was your thought process going into undergrad?
Realistically, I had no choice but to go to school. I am first generation American. My parents we are all of Haitian descent. And so going to school was not a option. It was more of, what are you going to do? And so I started off thinking that I wanted to be a nurse. And so that's why when I say, like, I quickly realized as soon as I was getting closer and closer, I did all my prerequisites for nursing, and I was getting closer and closer to like applying to nursing school. I was like, this is not what I want to do. And I had gone to our career counselor at Georgia Southern, and I was explaining to her, I'm like, hey, I've come to this point. I am realizing as I get closer and closer to making this decision to go into the nursing program here that I don't feel like this is what I need to be doing. I do want to be in the health arena. I do want to be able to have something in that area. Help me, please, like, help me. And she was so wonderful. She was like, well, looking at all your classes, it seems that you're also in the same track for a community health degree. And I'm like, what is that? And she was just like, and she was explaining to me. And essentially, at the time when Georgia Southern was doing this, there was not a bachelor's in public health education, but that's essentially what the degree was, which was a community health degree. And it was to the point that I knew that I had to be there, because once I started taking courses, it just started clicking. Like, it really just started making me feel like, okay, I can do this. I really enjoy the work that I'm doing. And the icing on the cake was that I actually was recognized as the community health major for like that year that I graduated. It was just like an outstanding community health student. And I'm just like, okay, Lord, like, this was where exactly I was supposed to be. And so I'm always thankful to Georgia Southern for, one, having that as having that as an option for a major. I didn't know about it going in, but I'm happy that I spoke with the career counselor that Georgia Southern had that as a major, but also it literally just propelled where I went in my career, because our dean at the time was just so phenomenal and made sure we knew everything, to the point that when I was in my graduate program, a lot of the assignments and things that we learned that we were doing or during my graduate program, some of those things I did in undergrad. So that's how much she poured into the program, into the students, and preparing them for the field. So forever thankful for that.
One thing I hear a lot in public health is like just people being directionally correct in their bachelor's degrees. Like many people go with the idea of going to medical school, nursing
Mhm.
school on those paths, but just understanding that when you get there, you're like, oh, I don't like blood, or like I don't like organic chemistry,
Listen,
and these kinds of things. And
yeah.
then it is a blessing to your point, knowing that you reached out to this counselor and they were able to support you and say, hey,
Mhm.
this is a part that you can do with the classes that you have done. And
Right.
like I think back on my journey, I wish that was the case for me, because
Mhm.
I've only found out about public health going into my master's of public health, which is it's not a conversation about me, but just I think
I
it,
promise you. I mean, during that time, this was 2008. During that time, public health as an undergraduate degree was very new, like to the field. A lot of times, I remember that even when I was letting people know when I was applying to grad school, they're like, "Oh, you have a bachelor's of science of community health. Like, what is that?" Because they weren't really familiar with that. So I would say Georgia Southern was probably ahead of the game to have that as an undergraduate degree. But now it's so popular to be able to have a bachelor's in public health compared to I just dated myself. It's over what, 13 years ago or so, 13, 15 years ago. It was a long time ago. I just dated myself. It's fine. But it was just one of those, it was not an option. Or I wasn't familiar with that as being an option. And so I was really happy to be able to see that. But like you're saying, it was one of those that, once you know, and as you get closer to something that you're either unfamiliar with or very uncomfortable with, and it's not changing, like you're not getting less stressed out when thinking about it, it's probably time to pause and rethink about what you're planning to do. So, yeah.
yeah. And you said you lived in Boston and
Hmm.
that you're in Georgia. What was that? And I feel like after that your career kind of stayed in the South.
Hmm.
So how was that a difficult shift for you, shifting from Massachusetts to?
Hmm. Yes, no. So we moved from Boston to Georgia because my dad got a job in Georgia. And so I completed, fortunately, my last 2 years of high school. So I was able to apply for the Hope Scholarship. I was so
Okay.
happy about that. So I was able to apply for or be considered for the Hope Scholarship. And so I finished my high school in Georgia and then went to hopped a little one or two places before I ended up at Georgia Southern. But as far as schooling, it was different, but just Boston in itself is different, especially when it comes to like healthcare overall. But when it comes to just the transition, I mean, it was challenging. I went from a very diverse community to not as much diversity in, my classes in Georgia, and just Georgia itself, at that time, or like 2001, 2002, it was a little bit different. Um, but I didn't let that stop me from going after what I wanted. If anything, I would say the move and just being in Georgia, it was meant to be. It was meant to happen, and I just took advantage of the opportunities that presented itself for me, and just move forward and just try not to look back. So, yeah.
Love it.
Hmm.
So during your undergrad, you were a field research assistant at the University of Alabama in
Hmm.
Birmingham. Tell us about that experience.
So that was my first, and when I reflect back on it, that was literally my first exposure to public health, and I did not realize that. So that was my freshman year. I was looking for internships that were out of town because I was like, everyone else is leaving. I might as well. And so I applied to different internships and got this with the University of Alabama at Birmingham. And it was honestly amazing. It was a summer that we spent in Mobile, Alabama, where we were participating as facilitators for a survey that they've been doing for like the past like 10 years. And so that was my exposure to one, see how as an individual to look like me, to interact with communities that look like me and talk with them about what are their risk factors. And so some of those questions included like, especially was like to youth. So some of those questions was like, how many times have you smoked in the past year? Or how many, it was just different questions to better understand their risk factors. And it was such an eye opener because I'm just like, well, they didn't smoke. And it was just like, yeah, I smoked like 3 times. And I'm just like, and I'm in college. I'm like, oh my gosh, everyone's lives is so different. But one of the great things I loved about it is they prepared us to just understand, like, hey, in order for us to gather this information, we are meeting these individuals where we are. So I was doing the questionnaire on the porch of, their grandma's house. I was doing the questionnaire in a community center setting. So we were literally young, I was from freshman in college, just going out into these communities, talking to these individuals, and just getting a better understanding of their life. And it exposed me to so much. It just really just broke down for me not only the innocence, but I say the judgment that I may have had of like far as how people got into certain circumstances, but also to really understand how as an individual that I can have a positive impact, even if it's such a short time that we're interacting with each other, but have a positive impact on that individual's life and get a better understanding of what they're going through that can help me in the decisions that I'm making, and later on, like when I'm thinking about a program I'm running or a community I'm serving. It just was it was meant to happen. And you're going to hear me say that a lot throughout this interview, where I truly believe in things are supposed to happen at certain instances in our lives. And I just knew that that was supposed to happen because I didn't even realize that was public health until like I put two and two together when I was in my community health classes. I was like, oh, I have done research. Oh, I have done surveying individuals. It's like, oh shoot, like I didn't even realize that's what it was. And so yeah, it was really cool.
That's a phenomenal experience to have
Mm-hmm.
your freshman year
Listen, dived right into it. Right into
right.
it.
Right. And it's always cool, like reflecting back to understand the things that we didn't fully understand or
Mm-hmm.
like just concepts of what we're doing. So that's really awesome that you were able to build that experience because I feel like many people don't get that type of interaction
Right.
or exposure. And I think one of the things you stated there is that it opened up your mind to what people could be like and just like
Mm-hmm.
understanding or demystifying or demything the idea that how people get into certain circumstances and different things like that, and just like
Yeah.
bringing humanity to the humans. I think is
Yes.
important.
Yes. I love that. Yeah.
So before we move on from your undergrad, were there any undergrad takeaways that you wanted to share with us?
You will finish when you finish. I am a 5-year undergrad individual, and I remember putting so much pressure on myself that I did not finish in 4 years. But when I reflect back on the turns that happened, I know that those specific things were supposed to happen, but also I was not ready because I didn't know what I wanted to do. Like, yes, I went into undergrad thinking that I wanted to be a nurse. As I got closer to that, it was just like I was putting extra classes because that would push the decision a little bit further back. And then I came to a point where I had to make a decision. And it was really nerve-wracking in order for me to make that decision. So that's when I went and sought out to speak to the career counselor because I was like, it's clear that I don't want to do this, but it's also clear that I'm not trying to add more years to my undergraduate experience because I've already added another year. And so by the time I got to that point, I knew that I had to do something, and I had enjoyed the classes I've taken so far, but I just did not want that specific outcome. And so me speaking to them, or me speaking to the career counselor, was definitely great, but it was also me coming to a decision to realize like it's going to happen when it's going to happen, and don't fault yourself that things did not turn out the way that you anticipated. It's fine. As long as you're okay, everyone else will be okay. So, yeah.
I echo that as well. I took 4.5 years to finish my undergrad,
Mhm.
and like reflecting on it, it did feel sad at the time seeing some of your friends graduate that
Right.
semester before. But like looking back on it now, it's like, who cares? I was glad to celebrate that time with them, and I was also glad to celebrate
Yeah.
when I finished my undergrad degree.
Right.
So
Right.
yeah,
Right.
things will happen in their own time, and that's for
Yes.
sure.
Yes.
Okay, so between your bachelor's and your master's, you had two positions.
Mhm.
Can you talk about them a little bit? You alluded to this first one as a program
Mhm.
coordinator at the Empowerment Center earlier, and then you were also a health educator at Positive Impact. So tell us
Yeah.
about both of those experiences.
Yes, I could definitely share about that. So, the program coordinator role at the Empowerment Resource Center was honestly like my first big girl job, I would like to say. And there was just so much learning. Well, we were a smaller nonprofit at the time. In my role, I was just continuing some of the things that I did as my volunteer role on top of some additional responsibilities. And that really helped me see that the work that we were doing was outside of just the organization. Miss Jackie was super involved in what was happening in the community at the city level as well as the state level. So, as a result of that, I was exposed to what was happening at those levels as well and got to meet some phenomenal individuals. And so, beyond the regular role responsibility of being a coordinator, it helped me to find ways that I can keep a tab on what's happening in the community that's impacting the work that I'm doing. And that was honestly the biggest takeaway that I had, that I feel like at times what they don't teach you in school, but you need to learn, is how to do your work, but also keep your eyes and ears open about what's happening around the work that you're doing that is eventually can impact that. And so I would be attending meetings where they'll be announcing like, hey, the CDC is coming out with this RFP. And it would just be like, oh, we can qualify for that. Okay, what do we need to do, with this grant writing process? Like, what do we need to do in order to ensure that we're in the know? But also, it was, hey, there is this funding that's going to be cut back. That is very important to know, that because that was impacting your work. From participating in some of these activities, that's where I got connected to my next job. And that's another thing I always tell people, like, you just never know who you're going to eventually be working with in the future. And so that's how I got connected to my next job, where I was an HIV health educator. And in that role, even though I had the title HIV health educator, it was more of a program manager role and responsibility, where I was responsible for the two programs that we were doing, one with college age students and another with older women. And so I learned in that specific role how to really run a program for real. And really understand how to use your resources when your resources are limited. That is one of the things that till this day I still lean on, as far as some of the skill set that I've learned. But also, when during that time, what it really helped me realize is I want to work with the decision makers, because there are a lot of things, I wouldn't want to say a lot, but there are a couple of things that decisions were made outside of our organization by by the entity that was giving us our grant, that really shifted how we were doing things in our own program. And I'm just like, well, why are we changing this? Like, why did the decision happen? What made them decide to do this? And that's when I was just like, how do I get to interact with the decision makers? How do I get to better understand why they're making certain decisions, but also how do I better help inform them of how the decisions that they're making can have a potential impact to the community? Because a lot of times when a leader or an executive is making a decision, they're thinking of the immediate outcome within their entity. And at times they may not realize there's a ripple effect that can happen that can eventually impact a individual or family member or something along that line. And so that's when I decided to get my master's, because I was like, oh, in order for me to get these jobs, to work with these individuals, I need to have an MPH. And that's when I was like, guess we're going back to school. So after 3 years of working, I went back to school, and it was great. It was a really good opportunity for me to take what I've learned, not only in undergrad, but also in my working experience, and be able to apply it to the work that we were doing in grad school. So, yeah.
Being able to run programs or know how to run programs, I think, is something that a lot of us in grad school don't even know how to do. So I could imagine just how valuable that was, seeing it from the ground up, as well as being part of a small nonprofit. I think gives you the access to be able to see how a nonprofit actually runs,
Right.
and all the little small and larger things that are going on, which I think are very, very important, and things that we many times don't get insights on
Mm-hmm.
in our MPH career, in our bachelor's career.
Mm-hmm.
It's only until we get into the workforce or we have internship experiences that allow us to do those types of things. So that is phenomenal.
Yeah.
And I think like that just kind of speaks to the point of taking time in between your bachelor's and your master's to get experiences,
Mm-hmm.
to really inform what you want to do, because it was through that experience you're like, okay, there are people that are making decisions that are affecting us.
Yeah.
How can I get into the space
Yeah.
and to influence that so that these things aren't happening?
Mm-hmm.
Because to your point, many times they are not thinking about the holistic effect of what they're doing, or like
Right.
what are the I can't remember the word. Yeah.
But basically, like, it's a ripple effect. Like, whether you want to know, whether you want to acknowledge it or not, every decision that is being made from the C-suite or from the executive team is going to have an impact on more than one individual. You want to have as minimal of an impact as possible. How do you do that? You do that by being as informed as you potentially can, and having people around you that provide you with that information in order to make the best decision. It's not always going to be clear. It's not always going to be black and white. There's definitely going to be some gray area in there, but you want to be able to be as informed, and that's where I come in. I want you to be informed. So, yeah.
You got your Masters of Public Health at the University of South Carolina. You
Mm-hmm.
told us why you wanted to get the Masters of
Yeah.
Public Health. Your concentration was in health services policy and management.
Yep.
Tell us why you wanted that concentration.
Because policy drives a lot of what's happening in our industry, whether it be public health or healthcare. If a policy is changed or updated, these are the things that individuals or organizations or even associations are looking into in order to drive outcomes. And so my understanding of how policy in itself and the management of policy in itself impacts the healthcare ecosystem is what I wanted. Also, another interesting thing is when it came time for me to go to graduate school, I looked at an MPH and an MHA. And so one of the things I realized is, like, I did not want an MHA. I love and I really appreciate public health, but I did want to have some of those courses that the MHA students had, such as finance, such as the healthcare policy. And there was just specific courses that were just not part of that foundational public health degree. And so USC offered that, where they had the HISPM. That's what, the acronym, the HISPM students and the MHA students. Our entry level courses were different, but the graduate level courses, we were in the same class. So I got to not only have that public health part where I'm learning public health at a graduate level, but I also had some of those business courses to really help me understand and be able to speak the language to the audience that I eventually am planning to interact and work with. And so that was one of the reasons why I selected USC, because I wanted to be able to have those two worlds, and I did not want to get another degree. So the way I can do that is by attending that school and being able to get that degree. So, and I can't forget, it was 18 months. I I will never ever do that again. But it was one of those degrees that allowed you to go from fall to fall. It was a lot of work, but I wanted, if I can do one less, semester in school, because I was ready to get back to the workforce and make money again. That was, yeah, fall to fall. Yeah.
That's real, and
Mm-hmm.
that's very, very intentional in everything that you see in there. Not only around getting back to the workforce, but being in a space that you're leading about not only the public health concepts, but the health administration concepts.
Mm-hmm.
And very similarly to you, I got my MPH in health management and policy. I think it's changed to population health management at this point in time.
Mm-hmm.
But yes, I was taking healthcare finance classes
Yep.
with the MHA students and different things like that,
Yeah.
which I thought was very interesting. But one thing that I like about taking that approach, the MPH, with like a management concentration more so than an MHA, is like it just gives you more flexibility in what you can do afterwards. An MHA is kind of directed directly into healthcare administration, while
Yep.
an MPH, you can go into that, or you can do many other things as well. So
Yes.
yeah.
Yes. I love flexibility. I love flexibility.
Yeah.
So yeah.
During your time as an MPH student, you
Mm-hmm.
were a graduate assistant at South Carolina Hospital Association,
Mm-hmm.
a project management graduate assistant, as well as you were the 2016 High Potential Diverse Leader at Georgia Center for Nonprofits.
Mm-hmm.
Can you tell us about those?
Yeah. So with the South Carolina Hospital Association, and I was also working at DHEC, which is the South Carolina Department of Public Health. Those two roles, I feel like, is the perfect combination of understanding who I am as an individual, where I have an interest in what's happening within the hospital, but I also have an interest in what's happening in the community. And so with the South Carolina Hospital Association, they are the entity that I worked with for my thesis. It was focused on the triple aim framework, which was very like the go-to framework a lot of hospitals were looking into during that time. And I feel like right now it's like they've added more aims to it since then. But it was for me to better understand how hospitals were using that triple aim in order to really have an impact in their community, but also with the areas that they found that were not up to par, what they were doing in order to work through that. So that actually allowed me to interview 3 hospitals in South Carolina, and not just any individuals. I'm talking about like executive level individuals. I had an opportunity to interview them and get a better understanding of how they are working and the best practices that they had, and take that information and be able to have that for the South Carolina Hospital Association to be able to use. So that was great. I truly appreciated that. With DHEC, my job was working with the Office of Evaluation. And so we were evaluating the impact of a CDC grant that we had at that time. And my boss, Kristen, was just honestly just such a down-to-earth individual. Like I'm going to go on a side rant, but there is something about having a supervisor that is willing to teach and pour into you that can really change how you view the work that you're doing, but also see how passionate they are about it. Like Kristen was amazing. I worked with her for about like 9 months, but in that 9-month period, I learned so much when it came to evaluation. I learned so much when it came to how to help and support community-based organizations in evaluating the work that they're doing and explain to them why the work that they're doing and the reporting that they're doing matters. Because I feel like at times as a government entity gathering information, we're so in the we need this, we need this, we need this, but we're not sharing the why we need this. And she was very clear in telling me and sharing with me the why that we were doing this, but also explaining to our team members and anyone outside of the DHEC team, like why we're doing this. So I learned just so much as far as like a skill set in understanding the work, but also being able to share the why, that till this day, that's just kind of like who I am. So those two specific time, like while I was in school, full time, might I add you. So not only was I doing these two jobs, but I also was in school full time. I learned so much, and I feel like it equipped me to better understand of how I can be of service in the work that I'm doing. But like I said, it really helped me see how these two areas, like I have a passion for both and I can impact both. And there is opportunities, I mean, in the work I'm doing now, to bring those two worlds together in order to do that work. With the 2016 nonprofit, that was a little bit after graduate school, but that specific program I participated in, I really got a better understanding of how to run a nonprofit during that time, but also why nonprofits matter. I think at times what tends to happen is when people think of a nonprofit, they think of not enough money, short staff. They think of, not able to make an impact beyond, this specific entity. And that specific cohort just really helped me understand that as a nonprofit, there's so much work that can be done. And there's so much opportunity to be able to partner either with a larger organization to get that work done. And so that nonprofit management really helped me just better understand it. Like I'm always willing to learn and to help understand, like that management piece was just so key. So yeah.
And it sounds like you kind of built off that program coordinating experience that you
Mm-hmm.
got before your master's program
Yep.
to really understand, okay, I got this one part of like nonprofit life. Now I got the entire broad
Yeah.
spectrum.
Yep.
And yeah, nonprofits are important, and they are definitely impactful, or they can be very impactful
Mm-hmm.
if they work well. So I appreciate you sharing that.
Yeah.
And then, did you have any takeaways from your master's of public health?
I'm glad that I went. I'm not happy about the student loans associated with them. Just being real. Like I think it was just I was pretty shocked that there was not as much financial support to get your master's as what compared to getting your undergraduate degree. And so I'm very fortunate that when I went to USC, there were certain like scholarships and things that I was able to receive. I mean, I still did have to take out student loans, but my biggest lesson, I feel like a lot of individuals are realizing this now, especially if it's been a couple of years since you've been in your master's program, is just like, it was worth it because it definitely took you to that next level in your career. And it's definitely something that a lot of roles that you may be attracted to are requiring. But when you think of the financial burden that is associated with advancing your career, especially you're coming from where you are the first generation going to college, it can be a little bit burdened. And it's just one of those where I'm just like, I don't know who I need to speak with in order for us to really, like, we're promoting and pushing and even requiring individuals to have a master's level education in order to be qualified for certain roles. But we're not realizing that that ask or that requirement in itself is putting a financial burden on an individual that at this time, not a lot of jobs may be giving you enough money to pay that loan back. And so it's like we're creating this cycle of financial instability that is just like, if someone tells me they don't want to go to get their master's because they don't want to be financially burdened, I have no desire to tell them not to, because I know it's one of those that it was a great decision. It definitely helped me in my career, and it definitely propelled me in a way that I know that if I did not do it, I would not have been able to be in the rooms that I've been in and I have the roles that I've had. But it's also one of those that, like, it is currently a financial thing that is like always with me. And now that, we got to start repaying back in October, I'm just like, yeah, I've learned a lot. And I just would like to add, when it comes to the public service loan forgiveness, it only applies to 501c3 and not 501c6. In the past couple of years, I've worked for 501c6, And even though they are considered nonprofit, but because they're associated with an association and there may be dues associated with that, you are not qualified for public loan, the forgiveness. I learned that the hard way. So,
Well,
yeah.
thank you for being transparent there. And yes, this is one of the huge issues I do see in the public health landscape, especially for quote unquote again traditional public health, because you're telling people to go to get a master's degree that might be costing them $68,000+ out of pocket, and then the jobs that you're getting aren't anywhere near compensating you for that. And especially if you're in a larger metro area, then the cost of living and that is a whole other thing. And I remember making a post on Instagram and LinkedIn months ago, like just talking about how you can make $100,000 in public health. And someone commented and said, "Why do you need to make $100,000 in public health?" And I'm like, "You can't be serious right now." I'm like, how I think about it is like, if people are giving value to this world, why can't we pay them what they're worth in that value? And this is a whole other conversation. And I feel like my thoughts are continuing to develop on this, and I feel like I'm gonna have to talk more about it as well. And I do know that there are people out there that are pushing to get public health student loan forgiveness like expanded, but once again, I don't think it's treating the root cause of the issue, which is the cost of the schools. And so I feel like, anyway, I have a lot of thoughts on this as you can imagine.
I get that though. I get that.
So yes. Thank you for raising that up, and more to come on that conversation, because I think it is a conversation that needs to be had, especially for people first generation who are Black and brown, who do not know how to navigate these systems and understand the financial burdens that might come of them. This is important things to think about, especially before pursuing a master's of public health. And and last thing I'll say on this before I hop off my soapbox is it is very interesting that yes, there are so many like opportunities for scholarships in undergrad, and then when you get to the masters, especially masters of public health level, it is so hard to get scholarships or research assistant positions that would help support you in that school. But a lot to be done, a lot to be said.
Yes.
I appreciate
we're on the same page, so don't worry. Whenever you have the conversation, just let me know, and I'll chime in too.
Sounds good. Sounds good. Okay, so you graduated and you became a program manager at Empowerment Resources Center, and that was a continuation from the job previously. So how did you transform into this new role, or what did that look like?
So for that role, when I had a conversation with Miss Jackie, we were talking about that they had started a behavioral health program, and she wanted to be able to take this program to the next level. And I was just like, okay, well, I think I can do that. I mean, I have program management experience. I've learned so much from graduate school. Behavioral health was starting to be a really hot topic for public health as well as healthcare at this time. There was a lot of companies coming out, and then there was a lot of policies, especially from like SAMHSA, associated with just like, how do we support behavioral health, but also substance abuse. So a lot of that was being tied, and this was like peak opioid epidemic time. And so I joined the organization again. And during the time that I was there, I helped build out the team as well as be able to help build the program. So creating SOPs, identifying who are the ideal individuals to be able to have for the team to be, or the program to be functional. And then also like, what are the things that we need to do in order for just to provide that great foundation for the program. That is when I realized I enjoy doing that. Which is I enjoy being given a program and being told, hey, we want to improve this, help. And so, or it's just like, hey, we have this concept of a program or an initiative we're thinking about doing, but we have not been able to just take it off. Can you help? That is where I find I'm excited. I'm able to like, I get free reign to kind of like test things out and really figure out like what works out. And so that was the time that, especially when it came to like behavioral health, I understood that this is a piece that, just like other areas, this is something that really matters, and that substance abuse does not have a certain look, that individuals suffering from substance abuse don't have to look a certain way in order to receive care. But we were able to help so many individuals who could not afford counseling or therapy. And that was something that I didn't realize at the time, but really helped me realize that how within the healthcare ecosystem, we are fragmented in how we're providing services, where on the other end, all the individuals need these services. So it's just like, well, you have to have insurance in order to get this therapy. I can't hold a job. So if I can't hold a job, I cannot have health insurance. And if I have health insurance that's through the Affordable Care Act, that health insurance is very limited on what it can cover, what it can do. And so, but I still need therapy. I still need to talk with a licensed professional about what's happening, because it is impacting my day to day and how I am as an individual. And it's just like, okay, so how do we get this accomplished? So just the opportunity to be able to help support a program that is serving the community, that is really helping us reduce the number of individuals that don't have access to care. I mean, it's checking all the boxes that I need and all I wanted. So that was a really great experience for me. And then shortly after that, that's when I transitioned to Chicago. So it was just one of those, like, a whole nother type of job opportunity. But every job that I have had, I learned so much from it, and it helps propel me for that next opportunity for sure. So yeah.
As it absolutely should.
Hmm.
And that sounds like a lot of fun, being able to say, hey, here's a program, make it better.
Hmm.
And
Hmm.
really like put that sounds like, so I feel like I would love to do something like that. And I feel like that was my idea for what I would be doing kind of coming out of my MPH, but didn't end up there. But neither here nor there once again.
Yeah,
We could
I
do that in
get
the
that.
future.
I get
Yeah.
that.
So you moved to Chicago. I'm
Mhm.
guessing this is when you had your contracting roles.
Mhm.
Is that
Mhm.
correct? Okay,
Yeah.
so you had two contracting roles,
Yep.
one at Davidoff Strategy, and then one as a nonprofit management consultant
Yep.
at Sisterhood of the Traveling Heart Incorporated. So tell
Yes.
us about those experiences.
So this was a time where I knew that I wanted a change of scenery. After college, I've been working in Atlanta, went away for graduate school, came back to Georgia, and it was just one of those, if it's a point that I think every adult or young adult gets to, where they're just like, there's more to this. And it's not the job that you currently have. It's not anything else. It's just more of something that you're just feeling on the inside. Like, there's more that I can be doing. I may not know exactly what that is, but I was also in a space where I'm like, I can take chances right now. I don't have children. I'm not married. I can literally take chances right now. And if it does not work out, it did not work out. And so that was one of the, that was really my inkling of why I moved to Chicago. And I had some individuals there that I knew. So it was just like, okay, I'm going to this place and I am going to figure it out. And so while I was there, I made sure that I was attending some nonprofit management meetings that I found on Meetup. I was also attending like some volunteer opportunities. So that's how I was kind of getting a lay of the land of what opportunities that are there. And so that's how I got that Davidoff strategy consultant role, as well as with the nonprofit management consultant. I was consulting one of my good friends in her nonprofit. So I was still able to apply the skill set that I had and keep up with that. And then a couple of months later, I got to start working at the American a Hospital Association. And that was just a big deal because for me, I took this chance and I went to a place that it was just like, why there? It's just like, there's opportunity. And it worked out. And that's why I keep saying, going back, like, it's going to work out, because it is honestly going to work out. I wasn't just kind of just sitting there and twiddling my thumbs, but I was finding ways to engage, finding ways to find opportunity and speak with individuals. And I actually got that job through Indeed, which was so random. But I remember I was just looking for public health and what type of opportunities there were, and this was an opportunity, and I was just like, okay, let's try and see. And then I got it, and it was great. Like, that role at AHA really helped me understand that I can have not only an impact locally, but I can have an impact at the national level. And there were some phenomenal individuals that I worked with while I was there that poured into me to help me understand what was happening at the hospital level, and really helped me realize that a lot of times when people are thinking of hospitals, they're just thinking of just one big entity. But I think of it like the way that we look at our organ system, where you have different parts within that entity, that in order for that entire entity to be okay, all these different departments need to be okay as well. And we were fortunate to be able to help these different entities in their initiatives for performance improvement. And I was able to apply my public health background, the skill set that I learned during my graduate degree, and learned so much from our team there that, like, till this day, I'm like, I know what C. diff is because I was working on the C. diff team. And it really helped me just understand what are the different things that are happening in our healthcare ecosystem that public health has a part in. And I mean, I'm still being able to bring two worlds together. That for me is just one world. So, yeah.
Take the risk when you are younger and you have less obligations.
Yes. Legit. Please do. Please do. Don't let it hold you back. Live in a different city as well. I always say that, like, live in a different city if you have the opportunity to do so. There's so much you can learn about yourself by doing that. Yeah.
I 100% agree with that. And just for clarity, you were a performance improvement coach
Yes.
too at the American Hospital
Yes.
Association. For anyone out there that might be wondering what your role was.
Yes.
And I think, like, I'll add something you've been saying, like, things, like, everything is happens to you, or like things are meant to happen to you. And I'll just add, like, things are meant to happen to you if you're actually doing the work. And,
Yes.
and I just put that out.
Yes. No, you're right. You're right. You're right. Each instance that I've had some really great opportunities, I'm doing the work. There's no time am I like twiddling my thumbs or not doing anything. But I also don't feel like naturally I am the individual to just chill and not, like, I'm finding stuff to do. Which can be a good thing or a bad thing, but right now it's been working in my favor, so we'll continue that way. Yeah.
Love that. And I also find it fascinating that you use meetup.com to kind of like meet these other nonprofit people, and just saying, like, there are just so many ways to connect and build community and see what's going on. So definitely use all those avenues. So appreciate you sharing that.
Yep.
You're currently a senior director for fellows in content strategy at the Nashville Health Care Council. So tell us about how did you get into this position, and what did you do, and what do you do?
So this position, there came to a certain point when I was in Chicago. This is peak pandemic, closer to the end of 2020, where I haven't seen my family in some time. My family lived in Georgia, and I realized that I've always been the child that's on the go. Even when I lived in Georgia, like, I'm traveling, I'm doing certain things. And just like everyone else was experiencing during this time, you just really look at what you have, and also you're reflecting on the time that you have spent. And I realized I really wanted to be back closer to my family. So I started looking at roles toward, like, at the end of 2020, I started looking at roles in the Southeast. And so on LinkedIn, I was just looking, and on LinkedIn and Indeed, because, Indeed worked for me before. So I was like, I'm going to go back to you again. So on LinkedIn and Indeed, I was looking at different roles that can potentially, like, align with my interests. And so I also did have my open to work, like, notification on. And that is how my former coworker, Jamie, had reached out to me and was just like, hey, I have a role that I think you might be interested in. And I looked and saw what organization she was working on. And I was like, Tennessee. I was like, ooh, I don't know, man. Honestly, because one, it was never truly honestly on my radar as a place to live. I've been to Nashville like a long time ago, but it was like a 2 day like trip. Like it was not even a very long time. But I was just like, well, why not? Like, why not see, what she has to say and about the organization? And at that time, I also was interviewing for another role in Georgia. And so I was just like, well, I mean, it's still not far. I did Google, how far is Nashville from Atlanta? Oh, it's a 3 to 4 hour drive. Okay, that's still like better than what I have right now in Chicago, where I have to get on a plane. And so I went through the interview process, and as I was learning more about the role, it just started to click that this is something that I want to be a part of. It allowed me to connect with decision makers. It allowed me to help them understand what is happening currently in the healthcare industry and also sprinkle in some public health. It allowed me to also get a better understanding of what is happening in Nashville, because at the time I didn't realize this, but Nashville is like the healthcare city. And a lot of people may not know this, but there's so much for profit entities located here, as well as there's a lot that's like a lot, if I remember correctly, when it comes to the companies that are based here, they may be based here, but there are a lot of organizations that have a national reach that the decision is coming from Nashville. And also outside of music, like this is one of the cities that have a lot of healthcare dollars as well as jobs. And so learning all these things during my interview process and also praying, I also want to just highlight in each of these instances in my life, I have been praying because I'm a believer in God, and just praying of like, okay, Lord, well, this is not necessarily a role I went looking for. This is one that you presented to me. And it seems to be checking the box of things that I'm looking for in order for me to grow as an individual, but also for me to learn more. So let's go through this. I think for me, it was when one of my final interviews, I was being interviewed by one of the CEOs of a large hospital entity that had a national reach. And I was just like, how did I get here? And I'm just like, okay, I guess this is it. Like, I'm gonna be in this role. And then one of the things that also happened, I was interviewed by former Senate Majority Leader Bill Frist, because he's the one that founded the program. And I'm just like in awe, because I'm just like, how did I get here? And since then, like just this role, I also had an opportunity to evolve the program in a way that, especially post pandemic, there was just like they wanted to revive the program. And I'm like, say less. This is something I enjoy doing. And so the opportunity to do that just really helped me. Since I've been in this role for 2.5 years, I've met so many great individuals who are doing such phenomenal work in healthcare. It has expanded my personal belief in the impact that I can have in the industry, but it also have helped me understand that people want to learn and they want to do good. And for us to assume that that is not the case because they're in certain positions or because they are working for certain entities, that is not in our favor. But if we approach individuals and we're meeting them where they are, whether it be in an individual in the community or it be an executive in a large for-profit organization, when we meet people where they are, we're truly able to have a better understanding of how we can better serve them and better work with them. And that's one of the things that I've really enjoyed in this role, because it has allowed me to see the impact that I can have, but I'm also able to see the impact an organization such as the council, how it can have an impact on the industry and continue to be able to grow what we're doing, not at just the Nashville, not Nashville, but the Nashville level, but to a national level as well. And that has just been a great thing to witness and see. And shout out to like all the fellows and the fellows alumni, because I learned so much from them. These are leaders who are having to make some tough decisions at times for their organization, but they are also phenomenal because they're willing to speak, they're willing to hear out, and they're willing to partner and collaborate in order to have a better outcome or better impact on the industry. So, yeah.
Kudos for you for all of that falling in line and
Listen, the
the
Lord is
growth
good.
and
The Lord is good. I'm not here to say that it was me. It was him. It was him. Yeah.
right, right. But you still did your part as well.
Hmm.
So thank you for like persevering and all the things that you do and just getting to where you are, which I think is awesome and important and good to know that Nashville is a health administration, healthcare
Yes.
hub. If anyone is thinking about that,
Yeah.
like look into that, see what opportunities are out there.
I will also add, when you're thinking of like venture capital, it's here. Tech startups, technology, it's here. Like if you have any interest in healthcare, look into Nashville. I think it will really surprise you. It's one of those hidden gems that I did not know about until I was in it. But now I'm just like, okay, if you're looking for a job, whether public health or healthcare related, look into Nashville. I think it'll really surprise you of what it has to offer as far as job opportunities, but also the cost of living is not as ridiculous as other places. It's getting there, but it's not there yet. So,
Right,
yeah.
right. Yeah, well, thank you for highlighting that. And I think that venture capital part of things is something that I think many people in public health have no idea
Hmm.
about, but I think it's an important place that we need to learn more about. And I'm hopefully going to get, and I'm speaking this into existence because I haven't spoken to us yet, but Ashley Wisdom, who started Health in Her Hue,
Yeah.
who has gotten venture funding for her work on the podcast sometime in the future to talk more about that, because I think that is phenomenal. And many times we in public health don't know the bounds to the impact that we can have. And just, I think just getting exposure and information is so
Hmm.
important. So thank you for lifting that up.
Oh yeah, no, that's from your lips to God's ears. So we'll get that happening. Yeah.
Oh yes, absolutely, absolutely, awesome. So you are also the host of the Access with Lydie podcast.
Yes.
Tell us about that podcast. What do you talk about?
Yeah.
Why do you start it?
Honestly, I started it this year. So after my brother passed away late last year, I have been thinking about how do I continue to have an impact in the industry beyond my role. I've been fortunate to have some very great job opportunities, but that's more than that's just a fraction of who I am. And I meet some really phenomenal individuals just from like just through my journey and my career. I mean, just honestly, just I'm an extrovert and just be talking to people. And so I wanted to be able to have a platform where I can talk about access to care, but I can also highlight some phenomenal organizations that are providing or serving in that area. And so that's where Access with Lydie started. I didn't think too hard with that. It was like Access to Care, and I was just like, oh, Access with Lydie. So that's where I started with that. And it's honestly been such a blessing because it's one way for me to share with the world how I am viewing the opportunity to learn more and to have an impact on the industry. But it's also an opportunity to showcase some of the phenomenal organizations that is doing some great work in order to improve access to care. So it's just bringing that together. And it's definitely a risk that I've taken, but it's been like, I feel like maybe for you, it's like the gift that keeps on giving by doing something like this. And you're learning so much about yourself as well throughout the process. So shout out to my team who's been working with me on this. This has just been a phenomenal thing. And it's a risk that I took, but just like any other risk I've been taking in my entire career and personal life, it's been showing up to be a really great opportunity and a great learning, not only for me, but for my audience as well. So, yeah.
Yeah, absolutely. If you want to continue to learn and grow and develop, definitely start a podcast. It would definitely force you to do that. That's for sure. As well as learn more about yourself, because those first episodes you feel so cringe hearing
You
yourself
look
talk.
back, you're like, Oh, I'm not sure. I'm not sure. But
Right.
yeah, I get that.
Right, right,
Yeah.
right. But but I appreciate you lifting up the point that even though you had phenomenal rules, you are more than the rules that you've had. And I
Mm-hmm.
think that is something that we always have to take into consideration, that we are more than the jobs that we do and
Yep.
the work that we do, and we can offer so much more to this world. So I appreciate you raising that up.
Yep. Glad to do so.
Awesome.
Yeah.
So before I move you on to the Furious Five, two questions. I'm just going to combine them.
Okay.
So where can people connect with you, and where would you like to see yourself in the future?
Oh, okay. People can connect with me on LinkedIn. It's Lydie, Lydie, Marc, Marc. And that's honestly the best place because I'm not really on social media beyond that. Just mainly because just keeping up with that. So yeah, so that's where they can connect with me. And I'm pretty responsive as far as just like connecting with people, meeting up with them virtually to learn more. And as far as where I see myself, I really would like to see myself in a role that allows me to continue to combine my learnings from public health and my passion with access to care and healthcare in one area. I've been fortunate that I've had roles that allow me to lean into all these areas and continue to elevate and grow. Um, I am not a type of individuals that I say I want to be the VP or CEO. It's just not my. It has not been my journey in order to say these specific things, but there are certain things that I want to either feel or be in that next role. So that next role, I want to be able to combine all these things. I want to be able to continue to have an impact in my community, which means that I am very big on being involved to the best of my ability and time. And so I want to be able to continue that. And just continue to meet phenomenal people. Like that has helped me on my journey to be able to learn about what's happening in around me, but also has been helpful to be able to share information with people. I'm always part of my tagline is connecting healthcare leaders, and I'm very intentional about that. Every role that I've had beforehand, and including this one, have allowed me the opportunity to continue to do so. If I see potentially two individuals or two companies that have an opportunity to work with each other or collaborate, I know it's my job to be able to just put that in their lap and just be like, hey, I thought of this specific individual or company that you may find resourceful or useful in the work that you're doing. Go forth and conquer. I just really enjoy doing that because it's really great to be able to see how just putting two individuals together can have an impact, and an impact to access to care is all that I ask for. So, yeah.
Yeah, and I feel like you exude a lot of the things that you're trying to do. So I think it's just growth in that role. And I think to your point of connecting people, building those networks are so important because there's just so much learning and knowledge and experience that we can gain from those kind of conversations. So continue to be the plug for our healthcare leaders.
I'll
So
try.
we appreciate you
I'll
doing
try.
that.
Definitely try. Yeah.
Awesome. So moving on to the Furious Five.
Okay.
5 questions I ask all guests.
Go
You
ahead.
got
I'm ready.
this. So number one, what advice would you give to a student trying to pursue a career in public health?
Be open, as well as know the reason why you're wanting to pursue this. I think a lot of times there may be challenges that you face that if you don't know your why, you can easily turn away from what you're called to do. So know why your why of why you're wanting to pursue a career in public health. Yeah.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
I would say be the individual that is willing to put yourself out there. With my current role, it's all about relationship building. And if you are an individual that is just always keeping to yourself and not wanting to learn more about the people that you're around, it's going to be difficult to do my job, or do any job, honestly. Once you get to that executive level, relationships matter, and building relationships and nurturing them matters. And so if you are interested in a role that I'm doing, I would say think about how you navigate networking and relationship building, because that's a huge part in my role, but also any executive role, especially you are sharing information about the organization you're working for, but you yourself are a brand. And so you want to be able to make your brand like a good one.
Number 3,
Mhm.
what's something you're working on improving in your life right now?
I know I wrote one thing, but this is another thing. I do not know how to swim, and I want to know how to swim. And so I am, rather than signing up for another board or another volunteer opportunity, I have been advised by some close friends to just do something that is helping me relax, but something I'm also learning. So I'll be signing up for swim classes. I will be the 36-year-old in the swim class. But that's something I'm working on, so that by next summer I can be swimming and not just like at the edge of the pool.
I love that for you, and I think that's something that too many Black people, especially Black people in the U.S., they just do not know. An interesting fun fact for the audience and for yourself: my uncle was the first Black person to win a gold medal in Olympics in swimming. I think that's a
Oh,
stat, but
that's awesome.
yeah. And I know he does some pretty phenomenal things, but this isn't a podcast about him. But if you do want to look him up, his name is Anthony Nesta. He's actually the current head coach for the U.S. men's swim team and
Hey,
University of Florida as well. So yeah, he's doing some big things.
you probably need to get
So
pointers from
I,
him. Just like, ugh.
I don't think you want pointers from him. He's a rough coach. He's a rough coach. Both of my cousins have swam with him. He's a
Oh
rough
gosh,
coach.
oh
Um,
gosh.
but yeah, but I hope that is inspiration, and I love that you're doing that because yeah, there's no better time to start and to learn
Hmm.
than now.
Yeah.
Awesome. So number 4, professionally, do you recommend anything?
It's a combination of professionally and personally. Um, there are two things that I recommend. One being, find something that helps your mind relax. One of the things I feel like we all learned throughout the pandemic is the fact that we have consumed our time with just things, and the things may not be of value to us. So find things that help your mind relax. Like, I know for me, I like to listen to my Audible books. I like to go on walks. So that's one thing. And another thing is, find your community. That is a very important part of who you are. And jobs will come and go. Degrees will remain with you, but the work that you've done for the degree will come and go. But if you have community, that is one of the best ways for you to remain grounded. And I have seen that how it has been helpful to me in my life, as well as like in different places that I've lived. I've been blessed to be able to have community. So those are the two things I would just put out there. Yeah.
And number 5, last but not
Uh-huh.
least, if there was one piece of advice that you would give to your younger self, what would it be?
There's so many things, but the biggest thing is, I would say to my younger self that there's nothing wrong with you for wanting to take the risk. Growing up in a Caribbean household as the only girl, I was wanting to do things that may not have been the norm. And as a result, I was questioned a lot as far as why I'm wanting to move and go away and do these things. But I saw that these opportunities would help me to be where I'm at today. And even now, I'm very thankful that my parents see that I was not crazy. It was just like, that's just who I am as far as my personality. And so I was just tell my younger self that there's nothing wrong with wanting more. um, it's okay, because you wanting more will help you along your personal and professional journey.
Love that.
Yeah.
Love that. Thank you so
Oh,
much, Lydie, for
thank you
coming
for
on and
having
sharing
me.
your journey.
Yeah.
Yeah. It's been fun. I learned some, I laughed some, so I think it's always a good
Good,
time
good with
when that
laughter.
happens.
Definitely good with laughter. Yeah.
Right. Well, good luck in your swimming classes. I hope that they go well and that
Thank
you
you.
feel a lot more confident swimming, as well as I know you were sharing before the interview that you have a convening coming up. So I hope that goes well
Yes.
as well.
Yes, we are definitely preparing for that. So there's just a lot going on here on this end, but definitely thankful for the invitation to be on this podcast. And may everything that you're doing with this podcast truly be blessed because you're doing some phenomenal work.
Thank you so much, and thank you for taking time to come on. I
Yeah.
really appreciate it, and I know this is going to be valuable to some people or a lot of people out there. So I
Yay.
appreciate
Awesome.
that.
Glad to hear that.
Yes.
Okay.
So housekeeping items, everyone. Thank you all so much for watching or listening. Be sure to subscribe if you've not subscribed as yet. Leave a like if you're watching it on YouTube. Leave a review, hopefully a 5-star review, and share it with a friend who will get some value from it. That really helps the show get out to more people. See you all next week.
Awesome.
Peace.
Bye.